אנחנו נחכה נראה לי עוד 2 דקות, ואז נתחיל.
Okay. Ruth, let's check if there's some English speaker in our audience or in our listeners. Tom, Sherry, Noah, Idan, Zelig, Roy, Todd. Hello to everyone. We just want to try to find out if you can hear us and if there's an English speaker in the audience or only Israelis are here. Thank you, Sherry.
As
I think that maybe for the sake of the recording, we should keep it in English. So if you want to post a link later for anyone, but
Okay. I think we should start, Ruth.
yes.
Okay, great. Thank you. Dr. Maram, stage is yours.
okay, hello to everyone. I do know I'm also the host. Okay, let's do it like this. I will share the presentation. We'll start talking and let's see how it goes. Can everyone see?
Yes.
Okay, and here.
Okay. Now, my name is Mira Maram, Dr. Mira Maram. I am the CEO of Bet Rivka Geriatric Rehabilitation Medical Center, which I will in a minute explain what exactly it is. Okay. I will give a short, hopefully short overview of Bet Rivka, talk a little bit about our innovation center, and then maybe the most important thing will be to talk about the call for proposals and to have a discussion. So, who are we? Bet Rivka is a part of Clalit Health Services, which is the Israeli largest health organization, and is considered to be the second, some say third, but we prefer to say second largest in the world, with almost 5 million patients or insured and 47,000 employees. Really a big health organization. Okay, most of the elderly are in the community. When an acute medical condition occurs, they often turn to a general hospital. Let's say you have a shortness of breath and you're going to the ER, the emergency room, and then they start treating you to the acute problem. Let's say you have pneumonia and you get antibiotics. Slowly, they begin to recover, stabilize their condition, but during the acute condition, some of their functions may deteriorate. This is precisely the time when we should transfer them to a rehabilitation center like ours so we can try and give them back their optimal function state, at least as it was before. Not every time we can do exactly that, but to advance them as much as possible. The faster we do that, we can send them home or to a facility which is suitable for them, and we can get better results. So it's very important that we do it as quickly as possible to get in our facilities, give them the best practice we can, and then return them home. Bet Rivka has a vision. We want to lead in every field and to be the leading geriatric rehabilitation center in Israel. Our aim is to improve the function and the quality of life among the elderly. To do so, Bet Rivka, we are the leader in elderly rehabilitation in Israel, and it is thanks to a few things. We're very professional, humane, creative. We continue to learn and study all the time, and always, always we're striving for excellence. I'll tell you some details about us, just so you know exactly what kind of facility we are. We have 291 beds, an average of 30 to 40 hospitalization days. Our average age of our patient is around 78. We have 7 wards. One of them is a daycare, but the rest are hospital. They are sleeping here and getting everything they need. So this is not very small, but not also the biggest hospital. One of the prominent features of this hospital is the multidisciplinary team. All the professional, the health professional, like we can see the physiotherapy, occupational therapy.
לא יודעת, רועי, אני לא יודעת, אני לא מבינה איך זה תכבש, הם רואים מסך? לא, אני לא מרשה לו. תכבה הכל, וזהו.
אפשר רק, please, okay, thank you.
Okay. And nursing, of course, and doctors. We have over 600 total employees, and as in every hospital, the nurses are the biggest sectors. You can look how many doctors we have, very few, and this is another one of our challenges because this is a profession in a very short supply. What is our motto? In this population, specifically the elderly, the care, the touch, the communication is very, very important. I think this photo demonstrates it very well. But maybe unlike where you used to think, we must dare. This is a rehabilitation center. So we should get the best technologies in this area, and this can promote our patient very well. It wasn't always like this, and we understand now care is very important. Dare is also very important. After a few years, I think 3-4 years of understanding that, and really you will see the advances we made in this area. We are now ready to share when we have many collaboration, which I will show you, just examples in a minute. As I said, we want to lead, and can we do that? So what happens since 2019, every year the national quality indicators in the geriatric hospital is published in Israel. And I must say with a lot of pride that we have perfect score in all the measures, 10. You cannot go higher than that. But this is not the only area. Patient safety is important, infection prevention, and as I said, we want to lead, and I think we are doing it very well in every aspect of the quality of care. We have many things that we can be very proud and say we are very good at that, and I will show you a few of them. We have a National Center of Excellence. This is our respiratory rehabilitation. And if you see those numbers here, a success rate of respiratory winning is 76%. This is not only a phenomenal figure in Israel, but in all of the world. So we even get younger people here because of our excellence in this area. Preventive medicine. We are a hospital. We are supposed to treat now who is in the hospital, but we are strongly believe in preventive medicine. This is why just recently we got the Silver Star from the International Osteoporosis Foundation. This is the only geriatric medical center in Israel that has this high star, which means that we are giving treatment to prevent osteoporosis fracture. Many of our patients fall and then come to rehabilitation here, but we're not only rehabilitating. In order for them not to fall again and not to have another fracture, we give them the preventive medicine they need so this will not happen again. We strongly believe in collaboration and community ties. Of course, most of our patients come from General Hospital, therefore we have very good connection and the collaboration with them. We understand that our patients are going back to the community, so we must have very, very good ties with them as well. And of course, academy, which support our research and innovation. So let's talk a little bit of innovation. This is a part of the strategy of this hospital. We understand we must embrace new ideas, new technologies, new practices, because if we want to be the best at patient care and staff well-being, you must do that. But it's not so simple, and we must really try to implement that as a culture in this hospital by training, by educating, by research, by development, and these are the things that we are doing in the last years. You say innovation and you immediately think about very, very advanced technologies. But for us, innovation is not only technology. In 2022, we won first place and we were named the leading health initiative in Israel just by this simple poster. Every patient that comes into our hospital, we ask him a few questions. Who were you? What did you work? What did you do? How did you look? You can give us picture of you when you were younger. This is part of our care, of our communication with our patient. And believe it or not, this was the 2022 leading health initiative in Israel, and it's only paper, written, but mainly humanity. So I said, in the past, let's say 3 years, 4 years maybe, we introduced many technologies in the area of rehabilitation, and we are continuing to do so because we believe that especially in this elderly population, this is very important and we can advance them very well. But this is not the only thing we care about. You can look and you can say, what is this? This is just a dynamic mattress. Why is this so important to us? Because with this, we can prevent like pressure ulcers. We want to have the best respirators, even wheelchair that are suitable. So we care very much about our patient safety and quality of care. In 2022, we were the first geriatric research and innovation center in Israel. And of course, we are supported by Clalit Innovation Team, but there was no one else at this point from the geriatric hospitals that was considered to be a research and innovation center. So we're very, very proud of it. And I believe we're not only have this title, we're working very hard in this area. Our innovation center, we believe that this must be a holistic geriatric team that can combine also compassion, communication, touch, but also the use of technologies to improve the quality care and the quality of life of their elderly. When you want to talk about Innovation Center, I can show you some of the things that we are already doing in collaboration with many. I will not go into each one of just to show you some of the areas we are going to explore more and more, combining AI, digital application of many kinds, telegeriatric, which everybody says at the beginning, no, they cannot use it. We think they can. We give it to them, and we have now many models so we can expand these things to more and more population. We have IRMed is just one of our startup teams that we are working with them. Look, this is the prevention thing I told you about. This is a prototype of the something that will identify the initial skin damage, and this way we can prevent what will come later as pressure ulcers. And we have a lot of data. Our patients are very, very complex. So we are thinking a lot how to get all the data in one place, very easy, so whoever is looking at that can comprehend the whole complexity of the patient and is able to treat him the best way. And even, 3D VR, we want to integrate it in our rehabilitation. We're already doing it. These are just some example of the things we're dealing with today and how we are going to continue in those areas. When we talk about robotics, we must understand first what are the challenges and why do we think that robotics can be an answer to many of them. Geriatric is not a glorious area of medical. If we look at that, it's a very hard physical job, first of all. And the second, there's no glory. We are not considered to do life-saving, procedures and things like that. And this brings a lot of staff burnout. It's not easy to work in this field. Many, many things that you have to do, not enough staff, and also not very glamorous. So we need to do something to address this challenge. We have, as you saw, many health professionals. It's not easy to synchronize between them, to get all the data, go around so everyone have it. This is another challenge we have. We don't have enough rehabilitation hours during the hospitalization. We must find a way to work more hours or bring more rehabilitation in other hours of the day. And we don't have enough response to the emotional needs of the patient. Loneliness is a very, very hard and serious problem at this age, whether they're in the community and even if they are in the hospital. We have some use cases that we prepared that we think that robotics, AI, and other things can be maybe one of the solutions. I will not go over them because you see by yourself the list. But if we think about proactive monitoring and communication with our patient, we can use AI on it, remote rehabilitation services, real-time transfer of administrative information between our staff, and many other things that, if you think about it, most of our health profession learn to be what they should be: physiotherapists, doctors, nurses. But in day-to-day, they do so many things that they shouldn't do. If we get a robot, something else that can take those administrative and other jobs from them and do it better, then they will have more time to do rehabilitation job, medical job, or whatever they need to do with the patient. And the burnout will be much less. So this is why we think that what they don't have to do by themselves and someone else can do it for them will be a very good solution in this area. Okay, so I explained so far what's in it for us, but you maybe ask yourself what's in it for you. So let's look at the situation. The elderly population is increasing in a rapid rate, but the number of medical staff is not expected to grow at the same rate. This will be a strategic goal to look for a solution in any health system. There will not be more doctors, more nurses, not in Israel and not in the world. At best, they will remain the same numbers. So if we found an answer that we can give to those challenges, it will not be relevant only to us. It will be relevant to all the hospitals. It can be applied in hospitals and in the community as well. And as far as we looked around, there's no real tailored solution. If we manage to do that, then a real solution will be needed in every health system in Israel, all over the world, and even private institution. So just think what market will be open for those solutions. Ifat?
Thank you, Dr. Moram. So I'm Ifat, Business Development Manager at Clalit Innovation Headquarters, supporting Betrivka in this call for proposals. Let me talk a bit about the process. So the most important date is July 19th. By then, you need to submit your proposal using the questionnaire that we prepared. You have the link afterwards, or you can go through our website. After you submit the proposals, a team of professionals from all sectors and the entire Clalit chain will go through the proposals and rank them according to the parameters that I'll present in a second. And then the chosen one will be invited to a demo day where they will present their solution to a group of VP and decision makers, including Dr. Moram that presented here. And then we will select up to 3 companies that will be piloting with according to specific KPIs that we'll define together. And the ones that will meet these KPIs will continue to a process with Clalit, where we can, they will be offered the opportunity to connect according to Clalit tenders requirements. Next slide, please. So talking about the evaluation criteria, we have 4 main pillars. All are based on the questionnaire and the questions that you are asked there. If needed, we can connect you and ask for additional information, but basically we'll evaluate based on the company financial stability, meaning that we want to assure that you have the funding to support the project, or the ability to support the project, and you won't disappear during the connection with you. Then we also assess your solution maturity and clinical validity. We want to understand if you have experience working with healthcare institutes, and if you have valid clinical outcomes. Then we want to assess your solution fit to the challenges that were described before. And we look at the comprehensiveness of your solution. Basically, if you answering more than one of the challenges, it's better for you. And the last pillar is your technical support and compliance with Clalit infrastructure. Basically, we want to understand if your solution can be integrated or work with Clalit systems. Next slide. Here you can see the web page and the click to fill out the questionnaire. You can also scan the QR code that appear here and get to the link. Thank you. We're now opening for questions.
I will stop the sharing.
I have a question. Not sure this was mentioned, but could you please verify a little bit about the funding opportunity for the pilot? Obviously, you want to see that we have enough stability to withstand such a pilot, and that makes sense. But what about working with you? Is there anything involved in that?
Yeah, so for the pilot, we will get the appropriate funding, and then afterwards we're kind of need to see that Clalit has the money for procurement.
But is the pilot funded? So let's say my device is, so it is fully funded by. And what is the pilot size, or does that change between the different products?
Yeah, so it is depends on the specific product and use case.
Okay. Thank you.
Other
There was a-
questions?
There was a question in the chat, so maybe we should go over the chat.
Can you read the chat, please, Ruth?
Yes.
want me to-
Or if she's with us.
Sherry, do
Yes.
you want to?
Can you hear me?
Good.
Yeah.
Yeah.
Okay, English, right? So, this may not be the appropriate setting for this question, but actually integrating robotics, AI, in general, managing rehabilitation and healthcare for the geriatric population with families is difficult because not everybody agrees and everybody fights and siblings don't agree. And depending on the cognitive level of the patient, there's even more complications. So I'm interested in and then adding the robotics and other technologies that are complicated perhaps at some point for not just the geriatric patient, but also for the families. I'm just wondering what your setup is to help manage implementation, expectations, and outcomes with family members. Not just when the geriatric patient is an inpatient, but also when they leave. And are you also looking for robotic, I don't even know if robotic solutions can help manage this, actually. I think it probably needs to be a human to human thing. But I'm interested in how you manage relationships with patient families.
Of course, we believe, we know that the families are very, very important part of the, managing the whole process here. We rely sometimes on their help, and sometimes we have to, be with them together to motivate the patient more and things like that. We have a very strong connection with the families, and any solution that we will give, it will be, according to the challenge we decide. I'm not sure every aspect of the robotics can be, used in any kind of communication with the family, but we choose what we are going to go with that. What I can say, it's like telegeriatrics. When we started, say nobody will use it. The elderly, they don't know how to use it. They don't have time, the family, to sit with them and do that. So we found out some of them can. After that, we said, okay, but those who doesn't, or we have a problem maybe with the family, and let's find another way to do it. We all the time find more and more tailored, models to either be best for the patient, best for the family, best for the caregiver. So I can't answer to every aspect now, but when we will start to develop it, we will address that. Of course, we understand the family can be a part of it. When it will be too difficult for one kind of family, maybe it's much easier with another kind. So this will be the things that we will have to profile. What is the problem? What is the solution we want to give? And there can be more than one solution to more than one family.
But in general, you have an infrastructure for supporting families in the process of integrating technologies into the care.
Yes.
And that, because that was basically what I was interested in.
Yeah, this is a part of our belief. We understand that.
Are you working with any other international? First of all, is this Michaz just in Israel, or are you also extending it to other startups outside of Israel? Not me. I'm not a robotics person, but I was just interested in general. One, and number two, do you have relationships, implementation relationships, research and development relationships with geriatric centers? I'm in the States, so in the United States or internationally, anywhere else?
We have one in Canada, Baycrest. We had with them, and kind of relationship specifically with the innovation center there. And yes, we are in touch with them. We're not, doing right now something with them, but we are in touch, and we thought of some projects together.
And this is not limited to Israeli companies only.
Okay, thanks.
I have a question about your telegeriatrics processes. Have you ever done anything with that before? Like using some other than robotics solutions for telegeriatrics?
No. Telegeriatrics we're doing for 4 years now. As you can imagine, it started in the Corona, 2020, at the beginning when nobody could go outside of the hospital or go inside the hospital. So we started then, and no robotics. We're doing just, the geriatric doctor here. But what we discovered, that what we started, only a few of the patients could do it. So since then, we're developing all kind of models. One model is the nurse is going to those that are, must stay at home and they cannot go out, and she's doing some of the tests there, and then they, interact with us, and we do that. We have other things, and we are still developing this, and also formulating the best standard for telegeriatrics. So robotics here can be only the platform, but we're doing this separately. This is just one of our innovations.
Got it. Thank you.
Any other questions? Okay. So
Okay.
if other questions, I think we can finish. We'll send you all the presentation by email, and you can see the recording on the landing page of the call.
Can I say something else? If the presentation wasn't clear enough, or you have more questions that you don't think about them now and you'll think about them later, don't hesitate. You can send them my email. You can send another email. I don't care how, but we will be glad to answer more of your question or, whatever.
Great, thanks. In the web page, we have Irit's email, I think. So
No problem.
You can contact us, of course. Okay, great. So thank you everyone for your time. And thank you, Dr. Maram and Ifat, for the presentation. And have a great evening.
Thank you.
Bye-bye.
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 Bye-bye.